People ask, why a specific program for a healthcare professional? What's different about a healthcare professional? In some respects, absolutely nothing. It's the same disease, it's the disease of addiction, and in many respects we treat it the same way, but there are really some differences. It's very hard for healthcare professionals to be a patient. It's really tough for healthcare professionals to take time off from work. They're responsible for the care of others. It's hard for healthcare professionals sometimes to connect around issues related to their work environment or the stressors of their work environment unless they get a chance to talk to another healthcare professional who really understands at a personal level what that individual's going through. Medical school, nursing school, internship, residency, fellowship, even working in the hospital environment is a pressure cooker. Individuals are expected to see patients in shorter and shorter period of time in an increasingly litigious environment with malpractice pressures, threat to reimbursement. And in the middle of all of that, the healthcare professional is expected to be perfect. That's impossible, and yet that's the expectation. When you spend your life trying to treat patients, it's hard to be a patient. The very skills that the person relied on to become successful, the very thing that's rewarded, becomes unhealthy. It's good to be compulsive, it's good to be single-minded, and that creates a tremendous amount of stress. So we work with that. We recognize that that's a normal feature of being a healthcare provider, and what's needed in that case is a sense of balance, a sense of perspective. They've been told from the word go, if you burn the candle at both ends, that everything's going to be okay. And so they do. They work tremendously hard, they focus entirely on achievement, and then they find, oh my God, it hasn't worked, my life is actually worse right now. And there's really a profound sense of betrayal there. I did everything that I was supposed to do, and yet somehow I ended up here. When you're in that scary place and you feel like everything has turned on you, you need someone who understands you. You need someone who can connect with you and say, I've been there, I know what this is like, and there is a way out. There's a successful way out.
I go back to my practice.
We make sure that healthcare providers have other addicted healthcare providers that they can interact with and engage with. And then in the vast majority of cases, we are able to successfully get people back to work. What we know right now is that 1 in 10 healthcare professionals has addiction. But fewer than 1 in 10 of those actually gets treatment. So a very small percentage of the individuals who actually need help get help. For us, it would be tremendous success if these individuals got treatment anywhere. But we know that we do a really good job of helping healthcare professionals with addiction restore their lives and restore their careers. So does treatment work? That's an important question that healthcare professionals ask because they're used to individuals with alcoholism and addiction bouncing in and out of the emergency room, never really getting sober, and develop the false impression that treatment doesn't work. We've got some excellent data to show that treatment of addicted healthcare professionals is extremely successful. Hazelden's healthcare professional program, just like Hazelden's program, is 12-step based. And being 12-step based means being evidence-based, because the evidence supports that the 12-step approach is the most successful approach in the management of this illness. Whether you go to Springbrook or the Center City campus, you're going to start in residential treatment with a comprehensive evaluation. And then you may, after completing residential treatment, step down through phases of care. How long does the program last? Well, that's very variable and individualized. And it's important that it be individualized. People are different, people's needs are different, and they're going to get treatment that is state-of-the-art. There are medications or pharmacotherapies that have been shown to be effective when added to 12-step therapy. There are other types of therapies that have been shown to be effective. If it's evidence-based, if it's successful, if we know it works, we're going to use it. And we're going to use it in a way that helps make a difference in whether or not this individual stays sober and lives a happy, fulfilling, productive life. When you walk across our campus, when you're on the wooded trails, when you're in the meditation center or just one-on-one with a staff member or another patient. The power of that experience is remarkable. There is something really profound that happens when one alcoholic or addict is talking to another alcoholic or addict. And it happens here every day, so many times a day. It's nothing short of amazing.